Hi, everybody. I'm Kim Skates, Membership Relations Manager at Central Houston. I am here this morning with one of our board members, Kim Bassett. She is president of St. Joseph Medical Center downtown. Kim, thank you for being with us today. Wow, this has just been an unbelievable year for medical professionals. How are you holding up and how is your staff?
Wow, what a year. Who could have thought, it's truly amazing. I've been a nurse for over 30 years and I've never experienced anything like this. Our staff is holding up incredibly well. It's been a really stressful time. Certainly early on in this pandemic, it was more stressful. It took us a while to get into a rhythm, but our staff has done an amazing job. And I'm so proud of the work that all healthcare workers have done in figuring out how to protect themselves, how to take care of our patients, and just, power through this past year.
And one of the frustrating ironies of it, even in a healthcare crisis, healthcare providers have been put in a really difficult position financially because you've had to cancel so many services. How are things on that end?
We're doing well, actually. St. Joseph Medical Center has done really well. We're part of the Steward Healthcare System, which is headquartered out of Dallas. And, being part of such a large organization has been a real godsend for us. It helped us early on when everybody was struggling to get PPE, and, our company was able to mobilize resources and make sure that everybody had what they need so that we felt safe and protected, and our staff felt like they had everything they need to care for patients. It was really challenging when I had to cancel surgeries because there was just so much that we didn't know, and quite frankly, nobody had enough PPE to be able to even do surgery. We needed PPE to be on the front lines, but one of the great things about St. Joseph Medical Center and our company is where we can quickly pivot, and we pivoted to caring for COVID patients. We opened up floors in our hospital and pulled in staff, and we started bringing in patients from all of the smaller community hospitals in the surrounding areas, all of the freestanding ERs. Patients were showing up to these freestanding ERs with COVID and needed to be admitted, and the hospitals were all busting at the seams and trying to figure out, how to care for this population. And so our staff really rose to the occasion. Our facilities team built isolation rooms and jumped into gear to put up isolation space so that our staff was safely protected and we could care for more patients. And so we pivoted, and we provided a niche in the community just to try to, care for more and more COVID patients. It became pretty overwhelming sometimes, the calls that we were getting from all of these smaller community hospitals that just didn't have the resources or the specialized equipment or staff to care for them. So that's what we did.
Are you back doing elective procedures now?
We're fully operational. We've been doing electives for many months. I forget when that went back into place, but the governor said, if you've got the personal protective equipment that you need, and as long as 15% of your capacity is dedicated to COVID patients, you can do electives if you have that ability. So that happened for us many months ago, and we're still caring for COVID patients now. We have them separated on specific COVID units where staff, are educated and comfortable caring for our patients. And so they're completely separate from our surgical patients. So we still have limited visiting. We're trying to reduce the number of people that come into the hospitals so that we make sure that we protect our staff and our patients and our visitors. So we do limit visiting, but otherwise we're fully operational.
And are you seeing COVID hospitalizations drop now?
We are. Just over the last 3 weeks, maybe, we've really noticed a drop. I think I have about 30 COVID patients in house right now today, and which is a significant improvement over what we had over previous months. So I'm a little anxious right now about spring break. I see, all of the things going on TV with spring break and the beaches, and I'm a little worried that we may see an uptick again, but we'll deal with that when it comes our way.
So when we spoke last, you had just gotten your vaccine. What do you want us to know about the vaccines?
Yes, I have been vaccinated. What I want everyone to know is it's so important to get vaccinated. It doesn't matter what vaccine you get. There's a lot of talk out there right now that one vaccine is 98% effective, one may be 92% effective. It doesn't matter. Get a vaccine, whatever vaccine you can get. It's the best defense we have right now against COVID. I know there's a lot of concern out there right now among some of the populations. I know the African American population. We held a vaccine clinic this weekend where we went to a church and we actually vaccinated 1,000 people. And I had an opportunity to speak to quite a few people who were very anxious about it. My own parents didn't want to get the COVID vaccine because they were concerned. I would say to people, get the vaccine. I've had my vaccine. My entire, administrative team has received their vaccine. It's the best that this country and the world has to offer right now. When we started a year ago, we didn't know that masks were the thing. I remember, the first week or two, we didn't wear masks. Now we know that masks work. And so I encourage everybody to get the vaccine. It doesn't matter which vaccine you get. It will help you. Even if for some reason you're part of that 1 or 2% that gets the vaccine and then gets COVID, it will protect you from getting such significant symptoms that you end up in the ICU and die.
Got it. Got it. Thanks, Kim. So a lot of companies right now are trying to figure out how to bring their employees back into the office. What should they be considering right now?
So I will tell you that here at St. Joseph Medical Center, we've had a handful of employees, less than 10, that we think were exposed at work in this past year. And that's due to wearing masks, washing your hands, and social distancing. Here in the administrative suite at the hospital, we didn't get to just close down when COVID hit, right? We don't get to go say, oh, sorry, I got to work from home. We had to be here to make sure this hospital was operational. So we all wear our masks, we all wash our hands, and we social distance at meetings. A lot of video calls and things, but the mask wearing is so important. So I would say to any business that wants to start bringing their employees back to the office, I would insist on wearing masks. B, social distance where you can. Receptionist desks, can you put up the plexiglass to try to give one more barrier? It makes your employees feel safe. Have a box of masks there that you can hand to people that walk into your building without a mask. Put up signs that say mask wearing is required. Unless you're in the office by yourself, you should have a mask on. And so if you can do those simple things, I think that you can stay safe. We had a couple of employees here in the administrative offices that became COVID positive, but it wasn't from within the hospital. They were exposed through a family member or something. And so they were here working for a couple of days, and then they find out they're COVID positive. And so the rest of us are like, oh my goodness, am I going to be positive now? Because, my coworker in the office next door is positive. And I'm proud to say not one of us, knock on wood, has become positive because we all wear our masks, we all wash our hands, and we all social distance. So it does work, and it works well. So my recommendation is if you want to bring people back in the office, you've got to have those 3 things in place.
So outside of the office, those of us downtown are really looking forward to bustling streets and crowded theaters and big sports arenas. Do you have any forecasts around when we might see that again and how that might be different than what we remember?
Boy, that's a great question, and I wish I was a visionary and could tell you what that's going to look like. I would say, Houston, I think we have great weather and we have the ability to be outdoors more so than maybe other states in the United States. So I think we'll continue to see more outdoor seating and outdoor events, maybe outdoor theater. I still myself, even though I've been vaccinated and I feel pretty comfortable, I wear my mask everywhere I go, I still am a little hesitant about being in an indoor restaurant. But I think if we continue to social distance in restaurants, if everybody in the restaurant is doing what they're supposed to do with wearing masks and such, I think we'll continue to see a resurgence of those activities. In Houston, we're all trying to give out as many vaccines as we can. So it's really just going to depend on, whether people get vaccinated and follow the rules. But I don't know how much longer that's going to be.
Yeah.
We'll see how spring break goes, right? We'll see
exactly right.
how spring break goes. If it goes well, then, maybe it'll be sooner than we expected.
Yeah. So when we get to that post-pandemic world, what are you most looking forward to downtown?
I miss the rodeo. I want the rodeo back. So that would be my first thought. And then just seeing people walking around downtown. I miss human contact. I miss hugs. I miss smiles. It's hard to see a smile under a mask. So I think that's what I'm looking forward to.
Yeah. Thank you, Kim. I appreciate you spending some time with us today. Best of luck to you and your staff, everybody there. We're so fortunate to have you guys downtown, and we're so fortunate to have you in your leadership on the Central Houston Board. So thank you so much, and thank you to all of you who have joined us today. We hope you got some good information, and we will see you downtown soon. Bye.
Thanks, Kim. Bye-bye.